Welcome, everyone. It's a great pleasure to be here today to present our latest policy document commissioned jointly by UNDP and UNICEF. The title of this paper is Latin America's Invisible COVID-19 Graveyard, the Intergenerational Human Development Losses Facing the Region's Poorest Young People. This is a document that calls for public policymakers to commit to the human development of younger generations. It's a paper that explores the problems brought about by the pandemic to children and adolescents and proposes, and a paper that proposes specific solutions. Before I go on to present the people that will be participating in the panel, just to let you know that this webinar is streaming live via our Facebook page, the Spanish version of the page, PNUD Latinoamérica, for anyone who wants to see it. And we are translating, we are providing simultaneous interpretation to Spanish. Hay traducción simultánea a español para el que quiera escuchar el evento en otro idioma. Having said that, we have an incredible panel today. We're going to have introductory remarks by Luis Felipe López Calva, our regional director for Latin America and the Caribbean and at the UNDP. And we also have regional director for UNICEF for Latin America and the Caribbean, Mrs. Jean Gaff. Then we will have a presentation by Horacio Attanazio, who's one of the authors of this document, written together with Ranjita Rajan. And then we will have a panel in which we have three experts in this topic that are a luxury to have with. We are very grateful that they agreed to join us. We have Florencia Lopez Bo, lead economist from the Social Protection and Health Unit at the IDB. We have Leah Fernald, professor of community health sciences at the School of Public Health at University of California, Berkeley. And we have Ariel Fisbain, director of the education program and the Inter-American Dialogue. The document that we're launching today is available both in Spanish and English on our website. So we invite you to consult them. We are sharing in the chat of this webinar the link to the documents. And without further ado, I am going to pass the word on to Luis Felipe López Calva, our regional director at UNDP for Latin America and the Caribbean. Welcome, Luis Felipe.
Thank you very much, Marcela. I take it that you hear me well, otherwise you will let me know. We are very, very pleased and happy today because we are presenting the second of a series of collaborations in terms of analytics with UNICEF, in addition to many things that we do on the ground with supporting governments. I want to start by really thanking Jean Go, my colleague, regional director for Latin America and the Caribbean at UNICEF, and thank her also for the trust and the spirit of collaboration. And of course, to Claudio Santibáñez, who was the head of the UNICEF team for the good collaboration. Also, I want to thank Horacio Attanazio and Ranjita Rajan. I think this is world-class academics that are collaborating with us to discuss this very, very important issue for our region in the context of this pandemic, and of course the discussants, good friends and people very committed to these issues. Florencia Lopez Bo from the IDB, Leah Fernald from University of California, Berkeley, Ariel Fisbain from the Inter-American Dialogue. And I also want to particularly and very especially thank Marcela Melendez, our chief economist for Latin America and the Caribbean at UNDP, and the team, not only for this particular product, but for all the work that they are doing to support the decision-making in our region. So this is a very, very good day in that sense. It's a happy day because we are harvesting after a long process of collaboration with UNICEF. This is one of those products. So it's very important to say that this is already the second year of COVID-19 pandemic that has become a defining moment for policymakers' commitment to human development in our region. As you know, our region has been severely affected, the most affected in terms of the economic impact, the health impact. Unfortunately, it is unprecedented historically. So we're talking about, in this case, the younger generations, so that the impact will have a lasting effect if there is no very, very rapid and proactive response. So, as you know, recent data has shown that over 100 million school-age children in Latin America and the Caribbean are at the risk of losing a full academic year of presential education with severe educational impacts. The learning poverty, as the World Bank calls it, will increase in a very important way in our region, and there is a massive destruction of human capital. Our region was, of course, not prepared for a rapid digital transformation of the educational system. These distance learning initiatives were put in place, but of course, it has been a huge challenge. So children in the wealthiest income group are, of course, more likely to access those tools necessary for virtual learning, while the gaps are most significant for access to the internet and computers. The gaps are also emerge in a more basic inputs to the educational process. Just things are as basic as a desktop to study at home, for example. Moreover, if a student's learning outcomes become more dependent on their parents' abilities during school closures, similar students with different parents' abilities or education will likely have different outcomes. This is something that I also recently started exploring with Roberto Vélez and Luis Ángel Monroy, using the mobility data in Mexico to show that in a region that is already has already very low intergenerational mobility, this may actually deepen or make it even worse in terms of intergenerational shock of this crisis. So parental education highly correlates with household income level, and it's likely that in poorer households, less educated parents will have more limited capacity to support their children in the learning process compared to rich households. So in the context of this crisis of COVID-19, inequalities will be increased, and will be not only increased in terms of a one-time shock, but maybe this effect can be perpetuated over time again if there is no very quick public action. So this joint product with UNICEF, written by two leading academics, the idea is to add to our understanding of this problem and to try to draw attention to these critical aspects, but also to try to trigger responses from policymakers. I think this is very, very important. We believe very, very firmly that this crisis can be seen, if the right actions are taken, as an opportunity for the governments to show their commitment to human development, particularly in terms of the intergenerational aspects of it. Policy actions, we believe, must support parents by improving parenting and caregiver practices, promoting gender equality in parenting through also fathers' involvement and changing in the way masculinity is conceptualized and exercised, and providing financial support for the poorest families. Simultaneously, policy actions for children and youth should be put in place to support formal learning, focusing on the delivery of accessible education and addressing the inevitable losses in curriculum content. We are already collaborating in different countries in the region in these aspects, jointly in many cases with UNICEF, but we are discussing in El Salvador, in the Dominican Republic, in Panama. We are collaborating very closely with governments in these new strategies. So while attention is highly focused on the health crisis, we want to bring now the spotlight and the attention to this intergenerational potential impact of the crisis. The clear message in the text that we present today is that we have to build on what we know, on the evidence that we have, and try to make sure that with what we know, we can take the right actions to anticipate the potential effects of this crisis, which are already visible and are already very deep. Just to close, I want to say that the schools also play a role in terms of the social structuring of the interactions among different actors in society. It changes the way domestic arrangements are made. It changes the way communities interact. It changes the way societies function at a larger scale. So let's look at these impacts not only in terms of the educational system, in terms of the human capital loss, which are huge, but also in terms of the impacts on social cohesion, mental health for kids, socialization, and other aspects that will have also a potentially lasting effect. So thank you very much. We will have a very rich discussions, and thank you again to UNICEF for this collaboration.
Thank you, Luis Felipe. I'm going to give the floor to Jean Gaff, Regional Director for Latin America and the Caribbean from UNICEF.
Thank you, Marcela. Good morning, dear panelists, co-hosts, and esteemed participants of this event organized in conjunction with the UNDP Regional Bureau. Delighted to share this space with Luis Felipe, a great ally. We meet again to present the third document of our UNDP-UNICEF COVID-19 policy document series, proposals of solutions for the crisis with strong focus on solutions to impact favorable our children's rights and their well-being. One important role of our organizations is to facilitate spaces such as this one, where key stakeholders and the overall community could raise, identify, and discuss over those upcoming challenges for the region throughout our post-pandemic recovery process. This document highlights some aspects to consider that they have not necessarily been presented in the public sphere, and therefore raise the need to generate evidence to build back better in our return to the SDGs path, and of course, accelerate results towards them. Today, our distinguished keynote speakers and panelists will dwell into the urgency we are facing to move forward in new forms of policy to address the challenges imposed by the pandemic and its implications for the development of early childhood and young people in the region. Without being a spoiler of the very interesting and relevant reasoning and calls raised in the document, and that will be presented today, I was excited to read about the strong call for community participation and development of local networks at the level of the neighborhood, the community, or the village as the most effective path for legitimate, sustainable, and long-term policy solutions. UNICEF has promoted for many years now the active participation of citizens, children, and adolescents as key change agents to support policies that will produce transformative changes. You may be aware that back in the early 1980s, UNICEF became increasingly concerned with the setback in health, education, and child nutrition arising in many developing countries. UNICEF was concerned on how international and national policies could be more effective to offset these setbacks. We developed our policy of adjustment with human face and made major steps towards taken to encourage the IMF and the World Bank to give more attention to poverty and human concerns in the making of adjustment policies, making the case that focus on individuals and their social actions are key for sustainable development. And interesting in young people, to create new democracies is the key. And here, let me do a parenthesis and add on to what Felipe had said. The education system, children has not been impacted so much from the health part, but the socio-economic impact and the closures of school and the restriction measures to control the disease are having significant impact on children. And I think we really need to invest in these young people to create a new generation, a new democracy. I think we need to invest more in our education, the quality of that education, in making technology available for the most vulnerable children. As we travel around the region, it hurts my heart to see how children in schools are closed, no electricity, no internet. And as Felipe said, their parents doesn't have that education to support them. So investing back in the communities in making those systems work for children and the most vulnerable, I think, is what the policy discussions that will come forward. So let's take this crisis as an opportunity to look at education, reimagine it, and an inclusive future to close this inequity and exclusion gap and to contribute to the full potential of all children and adolescents in the region. I think the time to act is now, and let's invite each of us here to really take bold steps and ambitious steps for the well-being of children. Thank you so much and looking forward for interesting discussion.
Thank you, Jean. It's my pleasure and honor to now introduce Horacio Attanazio. Horacio, I will turn on my screen 1 minute before your time ends. So the floor is yours. Thank you.
Thank you. Okay. Let me start right away with sharing my screen with my presentation. And thanks very much for the, let me see where it is. No, just 1 second. Okay, it's probably this one. Okay, can you see my, okay. It's just one slide, right? The main slide.
Yes.
Okay. Okay, thanks very much. Thanks to Marcela for the invitation and to everybody for organizing this event. And I would like to thank UNICEF, UNDP, and various colleagues with whom I've been talking about these issues. As has been said, the document has been available now for a few weeks, both in English and in Spanish. Let me start by saying that when Marcela asked me whether I wanted to write something around COVID in Latin America and COVID and the impact that COVID has been having on children and possibly intergenerational inequality. My first reaction said, there are lots of people writing about this. There are lots of people that know much more than I do about this. But then I changed my mind. I've been working now in Latin America for about 20 years. And I've been working on various programs targeted both to children and more generally to poor households in the region. And I think I've learned a lot. And I started thinking about what COVID has meant over this period. I became convinced that that I had something to say. And so I'll try to focus on these aspects. So what I'm going to do is these three things on the slides. First, I would like to summarize the key messages of the in the document, and that will take most of my time. I would also, I will try very hard not to exceed my time, if anything, to save a little bit of it, because I given the quality of the panel that is joining today, I would very much like to have an exchange and learn more about what's happening in the region and what can be done. And finally, you know, the document ends up with a call for action, and I hope that this discussion that we'll be having today can play a role in giving out messages that hopefully will be listened to by policymakers around the region. What's happening in the last year or the last few months it is amazing because, now last night I was rereading what we wrote with Ranjita, and I wrote a couple of months ago. And I come to realize that things are changing very, very rapidly in the world, but in the region as well. In the document, not coincidentally, it talks a fair amount about Colombia and India, that are two countries in which I work quite extensively. And, given the last events, unfortunately, dramatic events in both countries, much is changing very rapidly. Having said that, I do think that some of the messages that we try to give in this document are still valid. So what are the key messages in the document? First of all, is the inequality issue. Latin America is one of the most unequal regions in the world. Indeed, I've been part of a big project financed by the IDB and the LSE on the study of inequality in Latin America, which comes just next to a big report that the IDB issued about inequality in Latin America. And it's not just inequality in income; it's inequality, unfortunately, in opportunities, which is something about which probably we should care even more than we care about inequality in economic outcomes. And on top of this, the current pandemic is obviously having a multiplier effect on inequality. A multiplier effect that is evident now immediately because it's clear that both in terms of health outcomes and economic outcomes, the poorest in families and individuals in the regions have been affected by, much more by the pandemic. But as we try to argue in the document, and that's the invisible in the title, is the long run impacts are probably not immediately visible now, but they risk to be even worse and more dramatic. And they work through the effect that the pandemic is having on children, starting from the very young. What we know, what we have learned in the last decades, is that humans develop many of their abilities very early, and what happens during the early years typically has very long-run consequences. We also know that economics and other factors are very important, but they're not the only ones in determining child development in the early years. And parenting is in the first few years of life, is a crucial and key element in the process of development. And unfortunately, the pandemic is affecting all this. It's affecting parenting because the poorest, they suffer because they get a substantial economic hit. Moreover, they do not have, when nurseries and childcare centers around the regions close down, they do not have the resources to substitute that input with inputs at home. And moreover, suffering through what is happening increases parental stress, conflicts within the households, and makes parenting even harder than it is. And of course, I've been working over the years with people working in different dimensions and different periods of the life cycle. And the early years are extremely important because it's been shown so, because they are very malleable, but they are not the only one. They are not the only period which is important for human development. Teenage years are both difficult to manage, as some of us know, and very important in terms of development. And teenagers confined at home with school closed, without the possibility of seeing their friends, have been suffering particularly bad during the pandemic. And I want to stress not just the academic loss, although that's important, obviously, but also the loss of human contacts and interactions. And now for poor households in Latin America, this comes on top of a situation which is already extremely unequal in terms of education quality and the quality of the schools that poor households have access to. So this is a traumatic situation. And it's a situation that, let me add one point to the previous ones. It's a situation that comes over an existing very high level of inequality, and over a situation, if you look at what was happening in Latin America before the COVID hit, Latin America was going through a very interesting and in a way dramatic period. On the one hand, there were years in which in many countries, things seem to have been improving. Inequality seemed to be reducing. And yet, in the latest periods, even before the COVID, there was a deterioration, especially for the middle class, who had the impression that it was very easy to slide back in poverty, to lose things that have been gained previously. And we saw what happened in Chile, and then in Colombia, and in other countries in the region. The pandemic hit on top of all this ebullient situation. And now we can see again, especially in Colombia, some of the same phenomena starting again. So when we think about interventions on how to deal with the impacts of the pandemic, the main messages that we wanted to stress in this document are two. One is that we know that early years are important. We know that schools are important. It is not easy to design interventions that work. Many countries have, in the region and in other places, have tried interventions that have not been often successful, either in the micro or even worse at scale. One of the reasons for that is that it's difficult to design and implement at scale interventions that work. Another reason is that often the incentives that politicians have do not line up with the right things. It might be easier to build a new school and call a photo opportunity and cut the ribbons and start it. And it might be more profitable for a politician to do that rather than addressing the processes that go on into the school. And along similar lines, in nurseries, in homes, in families, what we need to do is to design interventions that change behavior. And those are not easy. That takes me to my second message, which is if we want to, if we think, and I do think that that's true, if we think that many of these interventions, especially for the early years, but not only, in order to work and to work as a scale, they have to change individual behavior. They have to change the behavior and the perceptions that that parents have, that teachers have, that head teachers have. And in order to do that, yeah, financial resources are important, but they're not sufficient. What we need to do is to channel the right messages through the communities, to the households, and so that they get implemented. And for that, I think community ownership and the changing of social norms is very, very important. And it's very important for scaling up. It is remarkably easier to design a small pilot and experiment and show that that type of intervention has an impact. It is much harder to scale that type of interventions for an entire country or for an entire region. And for that, that's my last bullet point there. I think for policymakers, it has to be important to use existing infrastructure. And by that, I don't just mean the schools and the physical infrastructure, but the infrastructure of policy interventions. Just to give a couple of examples that I know a bit. In Colombia, the conditional cash transfer program that has been running for 20 years now, Familias en Acción, which was designed as a copy of what used to be called Progresa in Mexico, then changed the name to Oportunidades and Prospera, and then was shut down recently, unfortunately. That's an attractive program, not just because it provides resources and to poor households, and has played an important role in reducing extreme poverty and inequality in a number of countries, including Brazil and Colombia, but also because it involves in the community. It involves the communities directly. Familias en Acción, the beneficiaries have to elect a representative, which is called the Madre Líder. And these ladies around Colombia play an important role there. In a way, the intervention, the CCT program is not just providing the resources, but it's also identifying the right people, the right leaders in the communities that can then be used to convey the messages, and they can be used to improve the sense of ownership and participation. And ownership and participation in the end is going to be key, not just for this, not just for the early years, not just for the pandemic, but it's going to be key to solve the problems that we've seen have been arising in Chile and Colombia even before the pandemic. The impression I have that in many countries in the region, citizens, and especially middle class and poor citizens, don't have a sense of genuine participation into society, and they don't sense that the society is offering equality of opportunities and chances in life. Let me just finish with the last point that Jean made in her introductory remark. This is hard. These are hard times, and the pandemic came and accentuated these challenges. However, I think it's important we see this as an opportunity to develop new ways to implement policies at scale, new uses of technology, the internet, the fact that now we are hundreds of people listening to us, it's a great opportunity, but we need to think of ways to use this means to deliver the right messages and the right policies. So I think these are the challenges that we have. What can we learn? And I hope that these discussions will address some of these points. I want to stop now because I've been talking for maybe too long, and I will leave these 3 bullet points on my slide. Thank you very much for your attention.
Thank you very much, Horacio. We are now going to move to the discussants, and we're going to start with Florencia Lopez-Bo, lead economist at the Social Protection and Health Unit at the IDB. Florencia, you have 10 minutes, and I will turn on my screen 1 minute before you finish.
Thank you very much. Let me share my screen. Let me know. Okay. Slideshow.
We are seeing it. Can you enlarge it?
Is that now good?
Yes.
Are you seeing one slide? Okay. So good morning, everyone. Such an honor to be in this fantastic panel. Thanks for the invitation. Thanks, Horacio, for the presentation right now. Great summary. It was a great pleasure to read the report by Horacio Attanazio and Rachita Rajan, really. Just let me start putting some context to Horacio's and Ranjita's study with some figures we collected at the Inter-American Development Bank. As the authors say right in the title, the impact of this pandemic in the most vulnerable children will be an intergenerational and plausibly irreversible human development disaster. First, infant mortality and morbidity could increase for the first time in 60 years due to increased malnutrition, missing immunization schedules, missing medical checkups. We've seen in a recent survey that 2/3 of households report not to be regularly attending pediatric appointments. We also saw that 85% of parents of young children report substantial impacts of the pandemic on their mental health. And we know that the mental health of caregivers translates into toxic stress in the parenting practices that Horacio also mentioned, the importance of parenting practices. Third, losses in development. We know now not only simulations that we have seen last year in many publications that the authors mentioned in the report, but now we are seeing real data, for instance, from longitudinal studies in the Chile's Encuesta Longitudinal de Primera Infancia, ELPI, and Uruguayan administrative data that they do every year, that this shows steep developmental losses, particularly for the poorest children, and particularly in a domain that is highly predictive of future success, that is language development. There has also been an increase in the risk of abuse of young children because of the many hours that children spend at home due to childcare and school closures. And last but not least, we have seen an average of 7 in 10 households with young children that their incomes have been reduced. And among them, 80% have reduced their food consumption. So food security, malnutrition, health issues is an important concern. So in line with what the report says, in addition to exacerbating inequalities in the most unequal region of the planet, the pandemic may also reverse 2 decades of progress, of important progress on the ECD agenda in Latin America. Something I wanted to mention is that these closures, particularly preschool and childcare, that's our study at the IDB, have left about 20 million preschool-age children out of the classrooms. Luis Felipe was mentioning this at the beginning. We calculated that this 12 months closure will have a long-term cost on earnings and future productivity of around 7.1 points of gross domestic product. And this has important heterogeneities among regions, as you can see in the slide, with the Andean region bearing the largest cost. What does this mean? This is 3 tax reforms. We have seen what happened in Colombia with a tax reform that is gonna provide us, say, 2 points of the GDP. So the cost of this is 3 tax reforms at a country level. So now going into the report itself, the study is excellent, of an extremely important issue for human development in Latin America, policy relevant. I love that the authors analyze both the early years and the 5 to 18-year-olds age ranges, but keeping the particularities of each age group, which are very different, but still everything is in the same place, which is very useful, particularly for policymakers and ministries that are working with both age ranges. The authors also recommend policy options that are very sound, evidence-based, also very creative. And I have some comments and suggestions in the next slide for more discussion. So I think there are 4 areas where I would have liked to see a bit more of policy prescriptions or discussion, and we can discuss that later if there is time. First, socio-emotional skills. When we think about the integral learning or development construct, it's key that we do not leave the socio-emotional skills consideration out of the picture. Social and emotional well-being should be core at the policy discussion right now. It might be difficult to measure. We economists have always have trouble measuring these skills, yet very important in this context. Children have experienced trauma, they might have lost a parent, a grandparent, or a caregiver, or even siblings. Second, measurement. Child development measurement and testing for older children is essential not only to track progress over time as services reopen and close, but particularly key to tailor remedial interventions. I mean, why is measurement so important? Because there is a range of potential losses that may arise, not only from the lack of access to in-person care or schooling, but also from the conditions and the characteristics of a global pandemic. We have mentioned parental stress, but there are so many other variables that could be affecting a child in this context that is very crucial to measure what's going on with these children. Third, I put it, prioritize the basics. The report mentions online tutoring for older children, as well as tailored interventions for the youngest, for the early years. And I believe it's important to prioritize because, as the Chilean data shows, the steepest learning losses has been in language. So considering reductions in curriculums will be important to recover those basics that might have been lost during the pandemic. Lastly, many families sought alternative education and stimulation methods to minimize the detrimental effects of the lack of access to in-person pre-primary and primary and secondary schooling. But those were the rich, the high socioeconomic status families have come up with all kinds of tutors, online services, and this adds to the already high inequality in Latin America that so much Horacio also highlighted, and Luis Felipe as well. I think it will be important to monitor the trend of inequality in access to services, also as Jean was saying, and outcomes of children, because this seems to be set up for an increasing and widening inequality in the region. So to close, I agree with the authors on the urgent, most urgent, also in the initial remarks from Jean, for policy action. The time is now. But I would like to stress 5 actions in particular that I also would love to have more discussion with the panel. First, child poverty has immoral levels right now in the region. To reduce child poverty, it will be important not only to leverage existing infrastructure, as the report says, conditional cash transfers, but also to redesign cash transfer programs to respond not only to the old needs, but to the new needs of households that have seen their incomes reduced. Second, to recover developmental and learning losses, the region will have to innovate and think harder on these hybrid ECD services and hybrid education modalities, as well as in tailored remedial strategies. Third, to close gaps, what I just mentioned in the last slide, in increasing inequality, it will be really necessary to expand coverage with quality in remote areas, so rural areas, indigenous populations, the poorest, but also those areas with limited connectivity where many of the services are not reaching them. Fourth, reopening childcare and school in a safe way is paramount, particularly for the youngest children. The limited role that children under age 5 play in transmission points to the fact that closures would bring little benefit to limiting the virus spread. However, the toll they take on learning and future earnings, as we showed, especially for the youngest, could be staggering. And lastly, I think in this period, more than ever, we need to focus on child well-being, on the whole child. Intersectoral innovations in both protocols and content of programs should include domestic violence, mental health, and nutrition, and this will be key to ensure children's well-being. Just in time, I think. Thank you very much.
Thank you, Florencia. Just in time, and thank you for a great discussion. We are going to move on to Leah Fernald, Professor of Community Health Sciences at the School of Public Health at the University of California, Berkeley. Leah, you have 10 minutes. Thank you.
Here we go. These slides look okay?
Perfect.
Great. Hi, everyone. It's such a pleasure to be part of this panel. I've been inspired by the words that my colleagues have spoken before me. I'll introduce myself just to say I'm a professor at the School of Public Health at UC Berkeley, and I've worked for 20 years in the context of global health and development, particularly focusing on early child development. I've also spent the last year at home with my 4 children who range in age from 8 to 16. And I realize I have so many advantages to be able to have work remotely. My husband can work remotely. My kids have been in online school because certainly, as a colleague of mine says, we're facing the same pandemic, but we're facing it in different boats. So I'll just say that my own experience has really opened my eyes to thinking about children who are so much more vulnerable. And I think some of the key messages from the paper that we are commenting on are so crucial to talk about today. So really this first point that this is a human development pandemic, and it's very much exacerbated by living in poverty. And I'll talk in more detail about that. Certainly there are negatively reinforcing factors, including the reduced ability to work from home. If you can't work from home and you're losing income, there's certainly consequences for child development. In addition, the point that was raised in the paper about the absence of in-person learning opportunities, cramped living conditions, increased likelihood of violence, poor nutrition, and poor health. So to start with today, I'd like to think about the effects of COVID in the context of a theoretical framework. And this is a model we developed a few years ago and presented in the Lancet to describe the context of child development. So up here at the top, we have optimal child development, which can be defined as improved cognitive, motor, social development, improved school performance and learning, and improved work capacity and productivity. And we know that child development is this interactive process that results in the ordered progression of perceptual, motor, cognitive, language, socio-emotional, and self-regulation skills. And although this developmental potential varies across cultures, there are progression rates and consistencies across the world in terms of child development. And so children reach this developmental potential when they acquire these developmental competencies for academic, behavioral, socio-emotional, and economic accomplishments. And we also know that in order for children to thrive, they need nurturing care. And nurturing care comes in the form of health, of nutrition, of caregiving, and of education. And you can see here all of the different ways that these factors support the nurturing care and the optimal development for children. Now, Of course, to support these factors, we need an enabling environment for caregivers and families, and then also a social, economic, and political context that makes it possible. And this has to do with having employment, housing, governance, political commitment. These are all factors that have come up so far already in the talks today, but I just really want to provide this overview then to give a context for what COVID has done. And really what COVID has done is threaten child development throughout the world because it's affecting every level of this framework. And that is really what we're facing. So lockdowns have resulted in difficulties accessing essential healthcare, reductions in vaccination rates, and certainly economic effects, as you've heard from Horacio and Florencia, are disproportionately felt by poor families. So as you also heard Florencia say, that there is a percentage of families that report delaying healthcare visits. Also in the United States, we see that a third of parents have reported delaying healthcare visits for their kids. So you also see then the indirect effects of COVID-19 on nutrition because families can't afford food or they purchase lower quality food. Caregivers, effects on caregivers and depressive symptoms, which I'll talk about in more detail, education with the school shutdown, and then of course, poverty, the larger number of children just living in extreme poverty. So to summarize really the effects of COVID for children living in low and middle income countries is that there have been disruptions across the board, not just in terms of increased child deaths, morbidity, mortality, but disruptions in routine healthcare, reduced access to food, reduced income, higher disease incidence, compromised maternal health, and then of course this leading to the intergenerational transfer of poor nutrition and poor economic conditions. So I'll point out that in Latin America in particular, that the effects on children are even more severe. So I know that you all have seen the news and know this well, but as of May 2021, Brazil had reported over 15 million cases, and Argentina and Colombia each having 3 million confirmed cases. And a paper that just came out in the last month showing that there's actually a more severe form of COVID-19 and a higher number of cases of the multi-system inflammatory syndrome in Latin America from a study of 5 countries, Mexico, Colombia, Peru, Costa Rica, and Brazil. And so this finding was suggesting that there's current evidence of this more severe disease pattern in Latinx and Hispanic children, and also then within that population of people of lower socioeconomic level. So these findings really highlight an urgent need for understanding the COVID-19 pandemic, particularly in Latin America. So I'm going to focus on a few things that came out for me of the report and just to highlight. The first really has to do with mental health and maternal mental health in particular, and the ability to provide stimulating and responsive care. We already know that depression is high in women, 2 times the prevalence of men. And we know that depression is high particularly in women in low and middle income countries, with pooled prevalence estimates of 1 in 4 women in terms of antepartum depression, and then 1 in 5 women in terms of postpartum depression. So I'm highlighting mental health because it has such important implications for child development. We also know that the risk for depression is already high in low and middle income countries for many reasons, because of education and lack of social support, because of disasters, food insecurity, all of these factors that are exacerbated by COVID-19. Because of poor nutrition, for example, folate, B12, calcium, iron, selenium, these are all micronutrients that are linked with an increased risk of depression in women. And then intimate partner violence, which includes psychological abuse, this is then also contributing to this risk of depression. And finally, that there are culture-specific factors, such as sex bias, that increase the risks of moms of girls. So this is really just to say, we already know that risks of depression are high for women. We know that they're high in low and middle income countries. And I'll show you just some data from a study in Bangladesh that we completed recently, which was looking at before COVID and then during COVID maternal depression rates. This is just a distribution in the population. You don't need to focus too much on all the details in the chart, but really just to say that there was a shift in the CESD score, which is the measure of depressive symptoms, that the shift got higher. So you'll see the difference in the graph on the left is that's before COVID, and then it shifted to higher on the right. So this is to say that in this sample of about 1,600 caregivers in rural Bangladesh, that there was a big effect of COVID on maternal depression, and it was worse in the families that had more food insecurity and worse poverty. So this was really suggesting that there was a differential effect even within the poorest households, of the most vulnerable in those households had more maternal depression. And to say that the effects of maternal depression on children are substantial, there's an increased risk of parents reporting difficult temperament, behavior problems, depression themselves in kids, having lower cognitive function among children, and then also having increased risk of having a child who's underweight or stunted due to maternal depression. So this is a really key factor, I think, in terms of thinking about the effects of COVID-19 on child development. So just to build on the key actions from the paper, and then also to build on what Florencia mentioned in terms of her suggested takeaways, I think that I completely agree that support is needed now more than ever. We really need a greater investment in children to make up for this lost time, for this lost year. I saw that people were calling it the lost year for a while in the news, and now there's more of a push to call it the stolen year, or something even saying when children are actually reverting, because it's not really just lost, it's really that the kids, it's possible they're moving backwards instead. There's a call for continued investment in existing programs, in addition to greater community participation and ownership of programs. So really this has to do with, as Attanazio mentioned, parenting support programs, daycares, preschools and informal systems, and group-based support that can help parents. And then finally, a push for policymakers to use existing infrastructure, for example, with the conditional cash transfer programs, if those programs are already reaching families, to then layer on other services into that existing system. And then finally, I know I'm out of time, so I'll just close with conclusions and questions. I was thrilled to hear the Florencia comment on the socio-emotional skills, because that's truly something that comes from children interacting with other children. And if they're not in a school setting, they're not necessarily able to have those interactions. And I completely agree and want to reinforce her suggestion to measure progress with regular tracking. I want to highlight, as I mentioned, caregiver depression as a consequence of food insecurity and increased poverty. This also could have a big effects on children. And so that's leading to the suggestion that we really need to support women. Promoting gender policies will be very important to help getting children back on track. And finally, the call for investment in existing programs, like conditional cash transfer programs, a focus on the most vulnerable families. And as Jean, just to echo something that Jean said at the beginning, if we can think about this as an opportunity to invest in alternative forms of communication, an opportunity to reach families who haven't been reached before through technological advances and other forms of communication. So with that, I'll just say thank you. And I look forward to having a discussion about this really fascinating report. Thank you so much.
Thank you, Leah. We are hearing of painful things and the big challenges that we have from here on. I'm going to pass the floor to Ariel Fisbein, Director of the Education Program at the Inter-American Dialogue. Welcome, Ariel.
Thank you very much. Thanks to both UNDP and UNICEF for the invitation, and Attanazio for really what I think is a very important contribution, particularly at this point in time. I think we still have a missing debate on the concerning situation of with children and youth in Latin America in the context of this crisis. In that sense, I think the title of the paper is powerful, right? Invisible graveyard. And the word graveyard, I think, here is fundamental, because it really indicates that we are probably experiencing the largest destruction of human capital in the history of the region. And I don't think there is sufficient discussion of that point. I will focus my few minutes on going straight to policy implications and policy recommendations. I think enough has been said on the effects and what we know about them. So I'll make a few points and start with one that was not mentioned so far, but I think it's actually perhaps because it's so obvious. But it's the point about vaccination. The reality is that all the various recovery measures that have been mentioned and that I'll be mentioning as well will have very limited reach and possibilities unless the vaccination efforts in Latin America are scaled up fast and effectively. And as we know, with perhaps a couple of exceptions, so far the region has failed quite dramatically in advancing their vaccination programs. And it's both a problem of supply of vaccines, but also the capacity to do so. So I would start with that point that perhaps because it's so obvious, not receive enough attention. But moving on, while the pandemic is rampant and then real recovery is not fully possible, what are the key coping mechanisms that public policy can help strengthening? And the paper mentions cash transfers, and I think that's the no-brainer answer. They're needed. The good news is that fiscal space does not need to be a serious concern if those transfers are well targeted. The main constraint is often an operational one, which is to have the institutional infrastructure for making the cash payments to the cash transfers to the right people. Now, fortunately, many countries in Latin America have built that infrastructure over time, and that's sort of a relative area of strength. The second, again, during the period in which the pandemic is still going to be very much a factor. A second objective is sustaining and actually improving the virtual education hybrid models across the various levels of education system. Now, the interesting thing is that in 2020, countries were forced to innovate and to find quick solutions, and we've seen quite a number of interesting things with all the limitations associated with the lack of connectivity that exists. The concern is that it looks as if some of the ministries may have given up and thought, okay, 2021 is going to be back to normality, and rather than building up on some of the efforts in 2020, we may see in 2021 less attention to a hybrid and virtual education models. And the third aspect of which was very much emphasized by Horacio and both Florencia and Leah is the difficult task of outreach to families during the pandemic. And clear here, I think there is total consensus that you cannot improvise and create things, or it's very difficult to create things from scratch. So you really need to build on the basis of existing programs. Now, after the end of a pandemic, whenever it comes, countries in Latin America will have to face what will be a major rebuilding, hopefully building back better human capital. And that's going to take, it's going to have to be a multi-year effort. It's not going to simply go back to where we were before. And here I think I want to make 3 key points. The first one is that the reopening of schools and childcare centers now, I think is remains a major challenge, but it's really fundamental. Children in Latin America cannot waste a second year without schools and child development centers being open and available to them. But reopening is just the beginning. What we need is, I believe, a major multi-year remedial education effort, which means different things for different age groups. Perhaps most obviously for in terms of basic education, it is, and I think Florencia mentioned this, ensuring basic learning for all. And there is a danger that schooling systems, as they reopen, may just want to go back to what they were doing before without really recognizing and having the tools to understand where the children are, both in terms of their social-emotional well-being and thus ability to learn and the learning levels. So this requires a major effort to be specific, to really be able to measure at scale, at the school level, where the children are when they come back, and focus efforts on a recovery of basic learning levels. For early child, for the earlier ages, for ECD, early childhood development, again, the same thing applies in terms of not just simply going back to where we were before, but essentially this is an opportunity to scale up those programs, whether they're home visitation programs or center-based care that have demonstrated that they do have an impact. Not all of them do, and that's a challenge. Just to finish, three messages in terms of what is needed. Financing. We're concerned to see that, in fact, 2021 may be more facing serious restrictions in many countries in terms of resources available for social services. Second, data. The need for every country in America to actually measure what is happening in terms of development and child development. And third, partnerships. This is a task too difficult for governments to do by themselves. There must be a role for civil society and the private sector in the response. Thank you.
Thank you, Ariel. Thank you, everyone. I'd like to thank our speakers and all of the participants that we had connected today. Sadly, we cannot, we will not spend more time having a conversation, but this is just the beginning. I want to close in saying that we will be happy to join forces with UNICEF to continue this effort and provide a space for Horacio, Ariel, Florencia, Leah, and all of those interested in pushing forward policy decisions that can help our children and youth in Latin America and the Caribbean to continue working and to continue the conversation. So this policy document that we presented today is just the beginning and in our effort to open up this conversation. Thank you all. Thank you, the people who were here with us today. We had around 250 people connected directly to Zoom, and a similar number of people watching us through Facebook Live. We will continue to work together with UNICEF in all the issues that bring us together in the fight to bring development for the Latin American and Caribbean region. It's been a pleasure. Thank you all.